for your being present over here. Thank you so much, and over to Sharma ji for next webinar pertaining to our MIZORAM.
Thank you. Thank you very much, sir. Now, we would like to welcome again in our 1284th webinar in 3 years and 710th webinar in this 1 year. Thank you. Thank you for your mentorship, cooperation, contribution as expert, sharing knowledge and blessing us on AYUSH Samriddhi platform. I would like to communicate my heartiest sincere regards to each and everyone joined in the webinar. I would like to welcome all the speakers, Dr. Vishnu Prasad Sharma ji, Dr. Laltan Kimi Lalte ji, Dr. Mosam Kem Yem ji, Dr. Sentila Iyer ji, and would like to request Professor V.K. Agnihotri sir for his welcome address.
Thank you, Professor Pawan Sharma ji. It's really again my...
Sharma ji is our speaker.
Well.
We will welcome
for the encouragement of all the guest speakers. A big person must be there as a backbone amongst them. So it's a great pleasure. And again, I am fortunate enough to really welcome you all. Of course, our northeast treasure of our country, though you are a bit far from us, but still you are with us. And this IRES platform recognize you and welcome you on this occasion. First of all, I extend my greetings for the great state of our Mizoram. Their whole citizen, the whole population is this is the high day for them. And really, what I am seeing, as Dongyam already told regarding the Arunachal Pradesh, fact is that it is near to Bhutan. I have gone to Bhutan and I found that really the nature is all over the Himalayas ranges, coming from this Meghalaya and Guwahati to all these Seven Sisters states capsule as such. And at the same time, which you are not appreciating by your own mouth. And I am seeing Professor Vishnu Sharma is the one of the witness that you people are also enjoying the beauty of these Himalayan states. Your presence, your beautifulness itself is a pleasure for us, that we Indians, not only the beauty stays there in Kashmir, it is also there in your states also. So Dr. Kimi is very much there. They are all of such a ornamented faces. We feel that how beautiful Arunachal and Mizoram is. So I welcome all the guest speakers with their knowledge and also with for their presentation. They are sparing of minutes that you are ours, and this IRES is with you. You always welcome over here whenever you feel fine, good and fine to be associated with our topics, with our all the days we are discussing about the diseases and medicines. You are always most welcome. And today also we welcome by heart that we are going to listen a lot of good information regarding this your Mizoram state, all the languages, that the uniforms, the characters, and the languages, the sweets, the good, songs, dance, celebrations, the important pious festival days, everything we are here to listen from you. So it's a pleasure that you people are here. Again, welcome. And then over to Professor Pawan Sharma ji for the connection and invitation for our guests from our this Mizoram state. Thank you so much.
Thank you. Thank you very much, sir. Thank you very much. I am requesting all the speakers today that please remind us, if we have missed any festival, please remind me only 2 days before, and we will arrange webinar to celebrate your festivals in your way. That will not be our way. In Mizo language or in Arunachal Pradesh language, we will be celebrating those festivals. Please consider this platform as yours. This platform is you. This platform is absolutely incomplete without you, because you represent northeastern states, and that is our really crown of the India. We say crown of the India. So, means I am, before inviting Vishnu Prasad sir, I would like to ask TK Laltan Kim, I hope. So, but how you place this teacup before your photo? Because you are also, Nishant Shukla ji showing us teacup directly in the video.
Can you hear my voice?
I am away. You are showing your teacup hot
Sir,
tea
I
cup.
don't know how did
Vapor
I
daru
put
hi.
it. So I can't remove it. That's why it's still there.
Great, great. Thank you, thank you. So now I would like to request Professor Vishnu Prasad Sharma ji to inaugurate this webinar.
Thank you, Dr. Pawan Kumar Sharma ji and respected Professor Agnihotri ji, Shukla ji, distinguished guests, ladies and gentlemen. So in this webinar, we have speaker Dr. Mukam, Dr. Santila Ayar, and Dr. Ralte. And you will be happy to know that Mizoram people are healthy and all our ladies are especially more beautiful because they have more beautiful, not only ladies.
I pointed out this thing. Really, you are seconding my statement. Really great.
Yeah, gents are also healthy because they keep themselves nearer to the nature. What nature gives, they consume more natural things. Instead of nowadays, the people they consume this fast food and this thing, but they like only natural food and they follow the natural laws of the nature. That is why they are more healthy. They can do lots of work, and I told already they are more beautiful, more beautiful. So thank you, namaskar, over to Pavanji.
Thank you very much, sir. Thank you very much. Now I would like to request Dr. Mukam Chemiem for his view regarding Mizoram. Welcome, welcome, Dr. Yim.
Thank you, sir, for the time. But Mizoram, I've not visited yet, but I've heard many times many things about Mizoram. And as our sir, as our Professor Dr. Vishnu Barsad had been mentioned that all people are very healthy, beautiful, and handsome. It seems everyone is like that. So I can see those things like that. So all the best to the Mizoram people.
Thank you, Dr. Mukam Chem. Thank you. Now I would like to request Dr. Lalkemin Ralteji.
Yeah, yes, sir.
Welcome, welcome, madam.
Can you hear my voice?
Yes, clear.
Okay, I'm audible, right? Yes.
Please explain in detail regarding your state. We
Okay,
are
sir.
eager to listen.
Today our state is celebrating 38th statehood day. Same with our Arunachal friends. Sir, one thing I want to highlight in this state day is Mizoram was in the 2 decade under the insurgency. It was started in 1966. We are insurgency from under insurgency from 1966. Thereafter, we get UT status in 1972. But still, the insurgency was blooming, even though we get state union territory status. The main problem is because we think that the center has not given important much to us, because in Mizoram we are in the far east state of India. So on 30th March 1966, with Mizoram National Front and Government of India, they have signed a peace accord, which is on 1966 or 1937. Sorry, I'm sorry about that. 1936. Okay, then thereafter in the 1938 of 20th February, Rajiv Gandhi, he has come to Mizoram and he has given us the state day. So today also there is a huge celebration. One special celebration.
Your mic is mute, please. Unmute, please unmute. Your mic is mute, ma'am. आपका माइक म्यूट हो गया है मैम. योर माइक इज म्यूट. प्लीज अनम्यूट द माइक. Yes. Okay.
Sorry. Okay, sir, can you hear me right now?
Amy, your voice is not there.
Good. Hello.
Okay. Yes.
Hi.
It's all.
Yeah. Sir, can you hear me right now?
Yes, yes.
Okay. Actually, what I want to mention is that today we had a huge celebration in order to commemorate the 38th year of statehood. There we had a prayer meeting in the whole Mizoram. As you know, Mizoram is the most concentrated Christian state all over India. And we are also the most concentrated tribal population in India. So today we had a grand celebration of a prayer meet. I think this is a huge grand of success because as in Ayurvedic point of view also, we are believing the holistic approach. So I can say that we celebrate our statehood in a holistic way. Sir, regarding the Mizoram, we had 80% of our forest is 80% of our Mizoram is still covered with forest. We are in the border with Myanmar, 510 kilometers border with Myanmar and 200 something with Bangladesh. So Mizoram has also, apart from Mizo, we are also having these other tribes like Sakma. And those who comes from Myanmar also, they are residing in our place as refugee. So I think there is lots of connection, people-to-people contact between Myanmar and Mizoram, because as you know, Mizoram, our history is begins from there, from Myanmar. So I think right now we are holding more than 30 refugees from Myanmar and from Manipur. As you know, there is Manipur crisis going on. So I think now Mizoram government is trying to give shelter for these refugees. So myself, I have gone to some refugee camp also. There we had a free health clinic also. There we had free health care and providing medication, Ayurvedic medicine, and also we have distributed to them. So I think, sir, regarding now I will move on to Ayurvedic point of view. In Ayurvedic, right now we don't have much faculty because only around 30 Ayurvedic doctor that we are in Mizoram. But one thing good I want to share is right now in collaboration with Amrit University and Mizoram University, we are having STI Hub. STI Hub, there we had Ayurvedic department. The research is going on in collaboration with Amrit University and Mizoram University. What we have done is they are going to do this Dinacharya lifestyle study. This scheme we are going to start now, and we will try to reach population as much as possible. And another thing they have done is also they are going to reach out the traditional healthcare providers. This documentation is going to undertaken under this STI Hubs, Mizoram University. So one thing I want to share to you is that also, sir, with me and in collaboration with Institute of Bioresource and Sustainable Development under Department of Biotechnology, we have done studies on Sacha Inchi. Maybe I think you have heard of it, that Inca peanuts. This is loaded with omega-3 and 6. I think you must have known the importance of omega-3 and 6. So I think this is not originally from Mizoram. I think we have taken the seeds from Thailand and all, and now we have cultivated in the whole Mizoram. So we are extracting the oil. Now we are doing clinical trial. And one thing I want to share is that also we are doing research on ground apple. As you know, ground apple is very rich in fiber, and it is used commonly used as pre and probiotic supplement. So what I have known is they have already made this ground apple syrup. They have sold in the market only 500 grams like that. It costs around more than 1,000. So now we are collecting this, which is available in Mizoram, and we are going to do comparison study with those available in Sikkim. And one thing I want to share is that in Mizoram, we also have these traditional healers, those who used to do that Rakta Mokshan, like that we study in Ayurveda. They are doing bloodletting therapy with traditionally. What they are using is they are using Serohon, they are using Madhuchista and all. So this is, we are doing documentation on this, and we are also trying to publish the paper on that. And now we also try to have done study on silajit that is available in Mizoram. We will collect the silajit which is available in the Mizoram mountain, and with the Institute of Bioresource and Sustainable Development faculty, we are trying to study comparative study on this silajit. Sir, I think with this I will conclude my speech for today. Thank you, sir.
Great. What may be the other name of your ground apple, as you told in Hindi, or some little bit familiar synonym?
Ground apple is yakun. In Sikkim and all, in whole India, it is the common name is yakun.
Yakun.
Yeah.
Well,
It's like tuberous.
tuberous, like potato or sweet potato.
Yeah, a bit like sweet potato, but bigger than that.
Or beetroot, something of the sort. Beetroot.
No. I think it will be like beetroot, I think, but bigger, very, very big. Because in Mizoram, without cultivation, also if they have taken out it, one only tuber can become more than 1 kg.
Is it a root of that Arabi or this Bengali Arabi, that type of thing, the rhizomes? Anyway, would you please like to tell me something in 2 sentences regarding this Mizoram beauty? That is very important.
Yeah.
Of persons as well as the geographical, both.
Okay, sir. Mizoram, actually, all throughout the years, the temperature is very moderate. There won't be neither too hot or neither too cold. And I think, sir, beauty of Mizoram, as you know, it is 80% of the forest, 80% of the land is still covered by forest. And most of the places you'll find only hilly places, so you don't have to go to other hill station. You can just come to Mizoram, and you'll find many hill stations. And also, sir, in Mizoram, what we have done is like we used to we cultivate Anturiam a lot, so we used to have that festival also, Anturiam festival. So that festival also you can come and enjoy. And sir, also what I want to say is the most celebrated festival of us is also coming on this March, that we celebrate as a grand, and with all the traditional things and all. In olden days, this festival they used to celebrate for 1 week, more than 1 week. And as you know, we are the tribal people, and we used to celebrate with all the local beers and all. But now after we became Christianity, and we don't celebrate in that way anymore, but celebrate will be grand. And even from foreign, they used to come to celebrate that Sapsarkut festival.
So I think that this is the low temperature is the clue point of the beauty, because the persons might be keeping cool and peaceful. They are not suffering from any hypertension, anxiety, and all these things. That makes them healthy, happy, and definitely beautiful and handsome. The lower temperature. This is a high temperature which makes tense, and sometimes yes, anxiety is there. So cool temperature is the clue point of the beauty, I think.
Yes.
And of course, a bunch of festivals and good Himalayas ranges, everything. And it's not a matter of any religion, whether it is Christianity or it is Sikhism or anything. The pleasure is pleasure. It has been manifested by the mental faculty. So when you feel pleased, it's irrespective of any religion, you enjoy the health and mental health also. Thank you so much for your association and contributing us a lot of information regarding the Mizoram. Of course, Lanthanwala was a great name. I think I am remembering way back in 1980, 84 during the time of Rajiv Gandhi. Lanthanwala, the great leader of your...
Respected Vishnu Prasad Sharma ji, your comments.
हाँ,
सुबह 3 बजे निकलना है सर मुझे दिल्ली.
कहाँ जाना है?
दिल्ली.
अच्छा अच्छा अच्छा, वो भी कहाँ है आप?
कहीं जा सकते हैं, बताते नहीं.
भोपाल सर. भोपाल सर.
अच्छा, भोपाल पर ही है. ठीक ठीक.
All the very best.
Thank you, Kimiralte, for your nice explanation. So I told already, yes, Mizoram is a very beautiful place. 80% is covered by the forest. Lots of herbs are there. Lots of herbs are there. And regarding hypertension, cases are less in Mizoram in compared to Assam. Very, very less, because they consume one nefapu leaf as their diet. So thank you, Kimiralte.
What is nefapu, sir?
Nefapu, one leaf is there.
Like bhang?
No, not like the bhang. It is a plant just like a betel nut. Betel nut leaf. So we did clinical trial here also. It have hypolipidemic effect, hypotension effect is also there. And there people, they consume that leaf once or twice in a week. That is why hypertension cases are less on that place.
Great, sir. Great.
Maybe this is my view. This is my view as a Ayurvedic practitioner or as a Ayurvedic doctor. So thank you. Next, you invite next speaker.
Thank you.
Sir, I would like to tell you, sir, one thing. This
Yes, sure.
Nepafu is also known as Poto in Arunachal Pradesh, and its genus name is Sclerodendrum, sir.
Sclerodendrum. Yeah, you are correct.
Sclerodendrum serrata.
Yes, sir. Yes, a lot of species are there. Genus is Sclerodendrum, and it is called here in Arunachal Poto sabji. And in Assamese, it is known as Nefafu Hat.
Nefafu Hat. Yes, you are correct.
Yes.
Thank you, doctor. Thank you for your value addition. I would like to definitely learn from Dr. Ralte that how this cup has come in screen, so I can present daily tea cup virtually to our audience. Great. Nice experience. Dr. Sentila, Vishnu Prasad sir, Sentila ji has joined.
Yes.
She was
welcome.
Okay, sir.
Welcome.
Sir, should I say something about my Nagaland State Ayush Department or?
Both Nagaland and Mizoram, both. We will be benefited by that.
Actually, I belong to Nagaland State, and even me, I didn't visit Mizoram State as of now.
This is also surprising.
But
Mukam Chemji is also telling that he has not visited Mizoram. You are also telling that you have not visited. I have visited right from Kolkata. So that's why. Please visit again.
Yeah,
Welcome.
Most of the time I was out of Northeast. So among the Northeastern states, I know only about my Nagaland state.
You speak.
But since Kimi has already told that today is their statehood day, so I would first of all like to congratulate the people of Mizoram on their statehood day. And as Kimi has already discussed about Mizoram state in detail, I think I'll agree with her regarding their medicinal research and those things, no? So regarding
our this one AYUSH system in Nagaland, we have 3 integrated AYUSH hospitals. The one which I presently attach is the first integrated AYUSH hospital. It was set up in, it is 10-bedded actually, and it was set up in 2016, September. It is a full-fledged 10-bedded hospital. Here, the people can avail both homeopathy and Ayurveda medicines at free of cost. The other one is again situated in the second one is in Noklak district. It is of 30-bedded. There are also the same facility. Both IPT and OPT patients can avail Ayurveda, homeopathy, and yoga. Regarding the third one is in Chetima, Kohima district. That is of 50-bedded Ayurveda AYUSH hospital. So there the people can avail both Ayurveda, homeopathy as well as naturopathy treatment. And if we see comparatively among the AYUSH practitioners, Ayurveda is one of the most preferred choice of treatment by the people in Nagaland. Slowly, the people in Nagaland are being sensitized about the benefit of Ayurveda treatment. And plus, along with our this one AYUSH system, we have our own traditional medicine, which has been practiced by our traditional healers. And one of the university in Nagaland, NICU, Northeastern Christian University, that is been assigned by the QCI, Quality Control of India, to certify the traditional healers all over India. So this certification process is also done with the support of Ayurveda doctors as the team leader. Thus, side by side, Ayurveda along with traditional medicines are been flourishing in our state. Plus, there is also one Ayurveda Research Center, Regional Ayurveda Research Center, and one Homeopathy Research Center. Both are situated in Dimapur. And there is also a good presence of AYUSH health and wellness centers in Nagaland, which has been functioning along with our village medical chairmans. Along with our AYUSH health and wellness centers, together we have AYUSH dispensaries, where AYUSH doctors are been working for the upliftment of our AYUSH system in Nagaland. So that's a short talk regarding AYUSH system in Nagaland along with our traditional medicines. So there, I would like to conclude my short talk regarding our AYUSH system. Thank you, sir. Thank you very much, sir.
Thank you very much. Vishnu Prasad Sharma, sir.
Thank you, Dr. Santila IR, for your very nice explanation regarding Nagaland. So you have mentioned that 50-bedded hospital, 10-bedded hospital, this are there, no? These are there anyhow.
Yeah, and 3 IH.
You people prescribe Ayurvedic medicine, or you prescribe their allopathic medicine also?
Sir, we purely practice Ayurveda medicines.
Ayurveda.
We get supply from government, so I totally fully practice purely Ayurveda. And now the patient level is also increasing in my OPT, so we are hopeful that Ayurveda will flourish in few years in Nagaland.
Very good, very good. Yes, please prescribe only, give treatment, Ayurvedic treatment to the patient. Because allopathic doctors are everywhere. Ayurvedic doctors are few. And we can show very good results of diseases. And regarding Parampara center is also there?
Yes, actually here in 10-bedded, till now we are just doing OPT, but in Chetima and this Noklak, where there is 30-bedded and 50-bedded, Panchakarma facility, naturopathy facility, all are available. So they can avail those facilities in those centers.
Achha. And within short period, I think Ayurveda Health Center will be open in some places in the northeastern region. as far as our
Yeah.
honorable minister's person. Anyhow, you have presented your explanation very nicely. Thank you. Thank you. Over
Sir,
to
with your
Thank
kind
you very much, sir.
permission, when
Thank
we
you.
are talking about Nagaland,
Mm.
I would like to invite Dr. Mukamchem Yim again, because now we are discussing on Nagaland and he can explain also value addition. Dr. Mukamchem Yim, welcome, sir. Please unmute regarding Nagaland now. Vishnu Prasad Sharma ji, please.
Mukam, please. Mukam, can you hear my voice? Mukam, please unmute. Hello, Mukam.
I hope he is not listening. We are not audible to him.
Is it audible,
Yeah.
sir?
Audible.
Yes, yes.
Welcome,
Welcome,
yes,
welcome.
please speak few lines.
A very good
Nagaland,
evening.
Nagaland.
Nagaland.
Now, he no few lines, elaborated description about Nagaland.
Yes, sir. A very good evening to my great teachers of Ayurveda and my dear colleagues. First of all, a very good evening from the land of Nagaland, land of festival, and also congratulations to the state of Arunachal Pradesh and Mizoram on this Foundation Day. So, as the previous speaker, Dr. Cindy, has spoken already something about AYUSH system in Nagaland. I would also would like to add some few lines. So, Nagaland is a state where its total area is 16,579 kilometer, and with the state capital of Nagaland, with a total population of 19,78,502. And we are celebrating Statehood Day each year in December, in the first state of December. And Nagaland state is a collection of many tribes. And as per 2011 census, Nagaland state is composed of like 16 tribes, and each and every one have their own major festivals. And mostly Nagaland, a very famous festival celebrating in Nagaland is the Hornbill Festival, which is celebrating in the month of December. So I welcome each and every one of you to come and join in during that program also. And as Dr. Cindy had been already mentioned about the present status of AYUSH system in Nagaland, I would also like to add some few things that which I'm doing. So as Dr. Balavi Golita from IIT Guwahati, IIT had spoken that she is doing research in the field of medicines in the field of Ayurvedic medicine. So me also, I'm doing my research under the guidance of Professor Dr. Vishnu Prasad Sharma. Me also, I'm doing with the in silico part of research. The in silico is that which I'm doing the compound of the plant, with the targeted protein. So, like I have already studied in the series, and Kandakari is also over in the treatment of bronchial asthma. So, in the studies, like in the collaboration with the Department of Bioinformative and Biotechnology and Information and Technology, like we have studied the plant of Dulci, Haritra, Kandakari, Yastimatu, Wasak, and all. Like we have extracted the compound of the plant. We have extracted the compound of the plant through KEGG database and the targeted protein of bronchial asthma. So with that, like studies are going on, and it's very successful, very effective result is showing. And as I've seen Dr. Balavi Golita speaking in this part, and I'm so impressed with those things. And then I would like to inform her also that we are also doing, and please to collaborate with us in the near future also. So with this, I would like to stop for today. And if any further clearance or further detailment I can share you.
Please inform us whatever the festivals you have before 2 days, and please recommend speakers for that. We will be organizing webinars for you, northeastern states, in your way. Again, I am requesting to all.
Yes, sir.
Dogam
Yes, sir.
Vaji,
Our Nagaland
please
state
tell
has
me.
minimum of recognized 17 tribes. So each and every tribe has their own specific festivals. And in the month of December, we are holding a Hornbill festival. In the month of December, from December dead 1 to December dead 10.
Great.
So during the time, I'll also try to invite you all, and we will try to make up something out during the time, sir.
Please inform us well in advance, so we will be inviting you.
Sir, thank you, sir.
Thank you, Dr. Mukam. Thank you very much. Now I would like to request Dr. Dojam Bojeji to add something. Please unmute. Please unmute. Yes.
To add on, I can add one more information regarding our AYUSH system in Arunachal Pradesh. That, sir, we have our own Ayurvedic manufacturing unit in under the District AYUSH Health Society, Government Ayurvedic Pharmacy. So we manufacture it is a government aided pharmacy. So we manufacture our own medicines and oils. So this I wanted to aid regarding the status of Ayurveda in our state.
Thank you very much. These are the information we are learning from you. Thank you very much. Thank you very much. Dr. Pallavi ji, would you like to add something? Dr. Pallavi Kalita. Welcome, madam.
Yes, sir. Sir, actually, we are always ready, especially our Department of Biotechnology and NIT Arunachal Pradesh. We are always ready with the different kind of herbs. And as my lab, basically, as I am working on phytochemistry, we are always welcoming the Ayurvedic people of our state, of the state of Arunachal Pradesh, not only Arunachal Pradesh, all over Northeast and even India as a whole. So we are always welcoming them to so that we can validate the herbs, and our lab is open. And I'm always ready to work with the molecules, the small molecules, the compounds, and also, if necessary, we'll go for the nanosynthesis and finally the drug. So that's why, sir, I can say one thing, like really, I'm enchanted with Arunachal Pradesh. It is really one of the mega diversity hotspot region of the world. And it is very beautiful. And you can say it is really the hotspot for the different kind of flora and fauna. It is, I can't explain, sir. I can't explain. It's really very beautiful. One of the most beautiful state of India. You can say it is like Indian Switzerland. One part of it looks like Switzerland, and the other part, it looks like Scotland. I can say that Zero Valley, it looks completely like Scotland, and the trip from Tejpur to Tawang, it looks like Switzerland, sir. No need of visiting those places. You can come to Arunachal Pradesh. You are welcome, sir.
It can be, ma'am, it can be vice versa, as we can say that the Switzerland is look like Arunachal Pradesh.
Kya baat.
Why should I say that Switzerland is? Why should I say that Switzerland is better? Arunachal Pradesh is better. Switzerland can be jealous to say that it is Arunachal Pradesh which is better to us.
Exactly, sir. Everything is Bharat. Everything is Bharat and Jai Hind.
Jai Hind. Great.
Yes, Thank you,
Now
sir. Thank
session
you.
is open. Again, before session open, comments from Vishnu Prasad sir.
Dr. Pallavi Kolkata has nicely explained. Yes, really, it is a Scotland, Switzerland, because snowfall is also there. Hotspot herbs is the very beautiful. Once you visit, then you can speak. Yes, it is.
I had been for Imami sir.
Acha, you was there at Arunachal Pradesh?
I have visited all 7 states, sir.
Oh, very nice, very nice. Then you know you have a very great knowledge about the northeastern region.
I am your neighbor, sir. I am in Kolkata.
Yes, yes. Certainly, certainly. It's a very Arunachal, not only Arunachal, all the northeastern place. If you visit any northeastern place, it's very good and full of forest. Herbs are there, and that is why northeastern people they consume more herbs, more natural things instead of chemical. First, they will try with the natural things. Then, if it's not work, then the people go for other chemical treatment. Otherwise, first they try with this herbs. So once again, I offer my sincere thanks to all the speakers from Arunachal Pradesh, from Nagaland. Thank you once
From
again.
Mizoram
Thank you.
also. From Mizoram.
I'm from Mizoram also. Ralte is there from Mizoram also. She is also my student. All are my student. This Mukam.
Our dream is that, sir, every state of the India should believe in Ayurveda like northeastern states.
Like that. Yes, yes. Because
That is our
Mukam,
dream.
he is doing a very great job on regarding bronchial asthma.
Great, sir.
Yes, clinical and the silico approach. And it shows very, very good result. Very, very good result. So thank you, Mukam, and all others, experts, including
Welcome, sir.
Pallavi Hui, Ralte, Santila. Thank you. Over to Pavanji.
From again, I am repeating, sir, to all speakers, please remind us 2 days in advance with recommendation of your speakers, photo and details. We will arrange from AYUSH Samriddhi your webinar in your way. Whatever the festival may be there, whatever the foundation day may be there, whatever the statehood day is there. So any festival, we are amongst you, we are with you in your pleasure. Please feel it.
Thank you, sir.
Agnihotre, sir. Now session is open. Yes, Mukam. Please.
Thank you.
Done, sir.
Agnihotre, sir.
Thank you, Pastor Pawan Sharmaji. Really, it had been a very good evening today when we visited.
Short and sweet. It is short and sweet. We have completed 2 webinars in 1.5 hours.
And that too with the new friends of our webinar and also our country. Now we find that we have got such great states of our country, considering Bharat as one. Especially since we all know that our IRES webinar is completely having the weight on the shoulders of Professor Pawan Sharmaji. And we are having speakers and guests like you people at our seat itself. They made a good parikrama of our northeast states in not only Arunachal and Mizoram, also Nagaland is being well remembered and talked about. So we have seen that Professor Pawan Sharmaji's touring back was getting ready for the tour. So will be the IRES pleasure that we are getting great parikrama, great touring along with his work, considering and sharing all the sites from Kashmir to Kanyakumari, from west to east and everything. And this is a way to know much more from the outreach areas where one is not directly reaching, but by you people's knowledge, experience and contribution, we are now enriched with the information that how the development of Ayush, especially Ayurveda, is getting flourished over your states. and your friendlyship is really touched our hearts, that how eager we are all to meet each other, to know about the details of this knowledge, even being so far from us. Especially, it's a great contribution of Professor Sharma ji, and as well Professor Vishwanath Sharma ji, who has produced scholars like you, those who are holding the torch of Ayurveda and getting famous with the activities, with the contribution in your places, at your places. So this is what the IRES recognition by you people, that you are doing a lot. Ayurveda is really getting rich and rich by contribution of you. And especially Sansari told that she is exclusively prescribing the Ayurvedic medicines there in Nagaland. This is what it is, because we are recognized and we are registered under this pathy. So naturally, honestly, we are supposed to deal with the Ayurvedic system, its principles, and all that, the medicine, whatever is available in your place, or you can import from the other states of our country. So really, it's a great pleasure that we celebrated 2 states on their 38th statehoodship. And really, it's a great pleasure that right from UT to full-fledged statehood is being given by Government of India to you people. And now you are definitely having a good budget, good areas, Itanagar and say this, what Itanagar and Imphal. And in Mizoram, and for Nagaland, it's Kohima. So these capitals are definitely getting a lot of development out of the developmental situation. Ayurveda is also getting developed. So I really thankful for you, Professor Nishan Shukla ji. And before closing, I think Professor Sharma ji's consent. I think tomorrow we will be having 2 webinars. One is on cardiac problem affections. The speakers will be Professor Nishan Sharma ji and Dr. Alok Sharma ji. And on Stars Day Vedic Medical Astrology, Professor Dr. Viprji Vishwanath Prasad sir has given the consent. 2 webinars will be managed on tomorrow.
Tomorrow our webinar time will be from 9 p.m. astrology and 10 p.m. heart disease.
Definitely, no problem, no problem. Yeah.
Because I will be on tour and I am not sure when I will be free.
We will be having our banner ready with the speakers and topics.
At 9 p.m. sharp, I will start the meeting.
Okay. Definitely. So I invite Professor Nishan Shukla sir for his comment on both the webinars topics. Professor Nishan Shukla sir, namaskar.
आदरणीय विश्वनाथ प्रसाद सर को भी नमस्कार है, वो भी आखिरी में कुछ बोलेंगे। और उसके बाद वो बताएं कि कल का टॉपिक क्या होगा।
जी सर।
निशान जी नमस्कार। प्रोफेसर निशान शुक्ला फ्रॉम आनंदपुर जामनगर राजकोट। I hope we are not audible to him. How it can be? आदरणीय प्रोफेसर, आदरणीय गुरुदेव विप्र विश्वनाथ प्रसाद सर कुछ बोलना चाहेंगे कल के विषय के बीच में? आदरणीय विश्वनाथ प्रसाद सर, शायद मेरी आवाज नहीं जा रही। आवाज तो आ रही है तो सर?
आ रही है आवाज सर।
स्वागत है गुरुदेव, स्वागत है।
नमस्कार।
So what will be our topic on medical astrology tomorrow at 9 p.m. sir?
Major topic is heart disease.
Heart disease, great sir, great.
All old people are suffering from the heart disease.
Yes,
so
sir.
It is better to discuss on heart disease. What is the factor behind this? What planets are working against this? So we have to justify now.
Thank you. So nice of you, sir. So nice of you.
बड़ा अच्छा लगा नागालैंड के बारे में जान करके, अरुणाचल प्रदेश के बारे में जान करके, मिजोरम के बारे में जान करके। वहाँ के लोग भी काफी इंटरेस्टेड हैं आयुर्वेदिक ट्रीटमेंट के लिए। having all tribes and caste and creeds, all are believing in the Ayurveda. That is a good sign of the development of Ayurveda with Ayurveda.
So nice of you, sir. So nice of you.
This means that all over India connecting with the Veda.
Yes.
Ayurveda is a product of Veda, or all tribes and even Eastern zone is connected with the Ayurveda, also connected with the Veda. Thanks,
And
sir.
Jyotish is also product of Veda. जी चलिए कल आपका पुनः स्वागत है, आज भी स्वागत हुआ और अच्छा लगा.
Please join us tomorrow for heart disorders, scientifically and astrologically.
Very good.
Both aspects will be discussed. So thank you very much, sir.
Thank you.
If anybody would like to say anything, welcome. Otherwise, we are concluding the webinar. Anybody? Nishan ji, आप रह गए हैं. प्रोफेसर निशांत शुक्ला, हेड ऑफ द डिपार्टमेंट काय चिकित्सा, शायद कहीं कंफर्टेबल नहीं है.
हाँ, आप लोगों में से कोई भी अपना फीडबैक देना चाहे, अपने गेस्ट स्पीकर्स, बहुत बहुत आपका धन्यवाद करते हैं. Any left out comment or any add on, really it's a pleasure to celebrate both the days on our webinars.
If anybody would like to have the certificate, please write to me in WhatsApp. I will send you the certificates of the webinar. This webinar is also now recognized webinar, I hope. So thank you very much. Good night to all.
Good night.
Thank you very much.